Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Kim Downey, physical therapist and physician advocate, who has appeared many times on the show and is a great connector, having me meet all these people, certainly within the physician burnout space. And one of those people today is Jodie Green, CEO, president, and founder of the Clinician Burnout Foundation. And we're going to talk about the Kevin MD article, Why Wellness Programs Fail Healthcare. Kim and Jodie, welcome to the show.
Thanks,
Thank
Kevin.
you.
All right. So Kim, I always start with you. How did you find Jody and why did you guys connect?
So she was one of my early connections on LinkedIn about 2.5 years ago, and we loosely followed each other, but we hadn't had a conversation. And I guess within the past few months, doctors started saying to her, "Oh, you know Kim Downey," or "Oh, you have to connect with Kim Downey. You have to talk to her." So she reached out to me and said, "People are saying that I need to talk to you." So we did, and from our very first conversation, we just started talking about how we could collaborate to amplify our support for doctors and other healthcare professionals. And this is one of the ways we decided to collaborate.
All right. And
Yes.
Jody, you are the CEO, president, founder of the Clinician Burnout Foundation. Just tell us a little bit about what you do, and then after that, we'll jump into your Kevin MD article, Why Wellness Programs Fail Healthcare.
So I'm not a clinician, but this comes from a very personal place. Been a caregiver for my family since the age of 17. I was still in high school. And father took off. My mother had very severe mental health and anxiety issues, and it was a little bit paralyzing. And my brother's autistic, though back then it was called mental retardation, just warehousing. And this is well before the internet.
Mhm.
So those clinicians who I could find, just an occupational therapist, a speech therapist, tie your shoelaces, improve speech, therapists for the mental health aspect for both of them. It was not easy, but I had such an attitude of gratitude because they could help them have a quality of life and thrive. And that just made me feel so great. And over the years, I never stopped having that
Mhm.
appreciation. I've always needed a large healthcare team. And so I got to know so many different kinds of clinicians. And my background is really more marketing. I've worked for the global advertising marketing agencies, always in healthcare. I did a campaign for the United Nations on psychosocial support. So it's something that's been very near and dear to me to always be able to help in some way as an outsider and still having that great respect. And as a caregiver, to want to care for those who care for us.
And both you and Kim wrote the Kevin MD article, Why Wellness Programs Fail Healthcare. Jody, for those who didn't get a chance to read that article yet, tell us what it's about.
It's about, maybe it was helpful to come from the outside in because healthcare burnout, moral injury, it's no single problem. It's very
Mhm.
complex, right? So there's going to be many ways to attack it from the inside out, clinicians like yourself, and from the outside in, non-clinicians like myself. And my background also enables me to see things a little differently. And I looked at the landscape and saw that so many hundreds, thousands of studies and surveys, and I've read tons of them since 2000 was when they were, really
Mhm.
consistent, though some really burnout articles in the 70s. And I wanted to do something that also felt more inclusive, not just physicians, which the big focus was on, but everyone, advanced practitioners, nurses, and the whole workforce. And I wanted to do something that was tangible and instant, fast, frictionless, free, because we underwrite it. And so what we do is literally give away, all underwritten by us, everything from Uber rides, because
Mhm.
if you're bleary-eyed, worked 87 hours in a day, probably feels like it if you're a resident, don't get behind the wheel. Probably dangerous for you and others on the road, but also we'll give you a ride.
Mhm.
You need food on the table, we'll provide that. Childcare, keep your house clean. Because my early advisory board members were often women physicians and had said, I wish I had had these things. So I wanted to provide for on and off the job. And everyone I spoke to, from med students, residents, longtime practitioners, it was always like I only have two priorities, sleep and food. That's it.
Mhm.
So I first looked at it from, okay, how can I help lift some burden on and off the job? Forget driving, we'll get you the food. And then I added on so many other things, a lot of health tech that can slash hours in the EHR, with structured data, very accurate, not error-filled, but really actionable data, and so many more things along those lines. And the reason I wanted to do some of that was things like Uber and food, they're something everyone could use, whether you're a clinician or not, because if the custodian doesn't clean the OR, a surgeon can't operate, right?
Yeah.
So everyone in the healthcare system globally can have access to that. And for those who practice medicine, they can have that for off the job, and they have on the job things. So I wanted to do something that was, we just hand it to you. There's no research. You tell us you have a need, and we will give it to you. And because I didn't want to be a me too, though I partner with others who do studies and surveys. My marketing background allows me to help get the word out in an effective way and get a great response rate. But I wanted to complement, not compete with that.
Kim, in the article, you guys talk about traditional wellness programs, right? And that's why Jodie needs to do all these supplemental things, because it's assumed that these traditional wellness programs aren't really doing the job when it comes to preventing burnout and moral injury. So, Kim, why do you think that is? Why do traditional wellness programs, and you've, I'm sure, seen so many in the burnout space, why do they often fail healthcare?
Some of it is if there is not leadership buy-in. And if they just offer, again, the historical yoga and pizza parties and
Hmm.
things like that, like sometimes it's not exactly what the clinicians really need, or if they aren't given time on the job to access those resources, once they get home, they're too busy and tired to do it. So we just really, I'd say a really key factor is leadership buy-in. It starts with like systems and leaders understanding that they have a critical responsibility to take care of their teams and offering the time and resources and to show that they really do care and to give them time to do it, and also to model it, that the leaders themselves need to be, they have to focus on their own well-being.
And if I may jump in, because that I forgot to say this before, but part of what I did was Clinician Burnout Foundation. We're literally and figuratively a foundation.
Hmm.
I looked at all the great efforts made to address burnout and moral injury, but they sit on quicksand. I call it the quicksand effect, because they don't tend to scale, or some of them fail because of a lot of what Kim said. I mean, we're not going to yoga our way out of this. You've already worked a long day. The last thing you want to do is now tack on a yoga class. So what we're doing by giving things away, my intention is to lift the bottom. Because if someone is literally drowning, or being pulled down by quicksand, they can't even take it in. Anyone, practitioner or not, when we're overwhelmed, we're paralyzed. The last thing you can do is even accept an offer, even if it's a great thing that's being offered to help us. So by lifting the bottom, we're restoring well-being. We're bringing up the emotional and mental and physical and financial stress. We're lifting those burdens. And by doing that, we're creating stability, and therefore our partners and others, what they can build on then, this will support everyone. This literally is a foundation, because now you'll have everyone in healthcare who we can help feel like, oh, that is a great idea. I can now take that in.
Tell us, Jodie, an example or story, just so we can really have that illustrated, where your foundation really helped a specific clinician.
Well, I think what we've really done early on, it was with health tech, very transformative, kind of Apple-like user interface and a NASA algorithm. And that was just an overlay to the Epics and Cerners with some AI in it, but it was instantly usable, like how we use a phone, all structured data, because NASA, no margin of error in outer space.
Yeah.
So we applied that same idea, and that's helped to slash hours and accurate billing, so it wasn't being kicked back for fixing and so forth. So that was early on. And also Uber rides. I've done that with a group of some residents, and just to be able to do that, they could sleep on the way home or the way in, and felt like Okay, tack on a half hour here, 45 minutes there of feeling more rested, not stressed to get there and through traffic. And even that made a difference.
And for the Uber rides, how would you find programs to partner with?
Uber is a partner. And
Okay.
so how people get these things,
Yeah.
thank you for mentioning that. They come to the clinicianburnoutfoundation.org website, and there's a sign up right there. You sign up for what you want. And as we have funds, which we raise through grants and sponsorships, individual donors, we also have donor advised funds,
Hmm.
trusts. As the money is in, we'll contact that person and say, here's your menu. What would you like? And then we'll pay for that.
So, other than Uber rides, what are some other examples of resources that you provide to these burnout clinicians?
As I said, it could be childcare,
Hmm.
housekeeping, talking to companies like Merry Maids or others that are national, but also those that are, they might be regional and local, obviously, and we're international. So with Uber, talking to Lyft, because they're international, right? Because we are serving those who are global. Uber's a good example because everybody gets what an Uber
Hmm.
is.
And Kim, I think one of the points that Jodie made was that you wanted to extend support not only just clinicians, but also to the ancillary healthcare staff as well. Tell us why that's so important.
Because none of us can do this alone. And I do love it when sometimes on LinkedIn doctors spotlight their team and they're like, it would be hard to make it through the day without my medical assistant. Well, as Jody said, what if the medical assistant, again, they don't make much money? What if their car is in the shop and they can't get to work? Like that affects the doctor. And it's just so we can all support each other, that we're all part of a healthcare team. I'm a physical therapist, right? So a doctor can do the orthopedic surgery, but then they send them to a physical therapist. And the outcomes wouldn't be as good if a doctor does a knee replacement and the patients don't have access to physical therapy. So, like, we're important members of the team too. So, I do, even though my personal focus is on physicians, I fully understand, and I am another healthcare worker, right? Part of the team. So I understand the importance of supporting all members of the team.
Jody, that you've been around, of course, clinician burnout with your foundation. What would you say are the main drivers that is leading to worsening burnout rates?
You know, I, I I think it's been around for many, many years, at least 15 years before the Affordable Care Act, and moving from paper to electronic healthcare records. And that probably started more often with it became a medical industrial complex in the 80s. I
Hmm.
mean, that's when it started. And over time, it's been profits over people, as you
Yeah.
know. It's been greed, it's been neglect. And as I say, it's a healthcare, it's a system, and there are weak links. When the weak links fail, and the links are everyone who's within the system, ecosystem globally. And so when there's neglect, burn, and devaluation with moral injury, we're left and cutting costs. I mean, look, nurses today are said to have the most violent job in America.
Hmm.
And it's not just nurses, though. It's absolutely terrifying. So I think what happened, COVID ripped off the curtain, right? Pulled it back. Couldn't hide it anymore. Who cared about now? You can't hide malpractice suits or whatever else was trying to hush it up.
Yeah.
It's out in the open. And I still see the statistic, though it's been for years, 300 to 400 physicians, die by suicide every year. Frankly, that's been used forever. I'm sure that it's many more now, post COVID, but one suicide is one too many. So our goal is to definitely help not lose a life. And as a non-clinician, boy, that would be amazing to me, but also to definitely address burnout. We can eliminate it if we work towards that.
And Jody, what does it say about the system that it requires outside organizations like yours to really help address the burnout rather than organizations themselves addressing and fixing the problem?
I think it's because, as I said, I'm an outside in, so I bring different perspective, right? We're all living it. We're all patients. Obviously, every clinician is a human being and patients themselves. but I think it's going to take many different types of attempting to fix things. And I think, the great awareness groups, but so many are still raising awareness. And I'm right there. Obviously, we need to raise awareness about our own foundation and the issues, but we need to do things active, quick. There's a lot of echo chamber that's still going on. And I think it's great to be discussing it, but I've been to conferences too, and people leave like, yeah, I feel that way. Now what? So that's why I wanted to do something that was strategic, but really tactical. Like, here's the tactic and we're doing it.
We're talking to Jodie Green. She's the CEO, president, and founder of the Clinician Burnout Foundation, and physician advocate and physical therapist Kim Downey. Today's Kevin MD article is Why Wellness Programs Fail Healthcare. Now I'm going to end by asking each of you just to share some take-home messages to the Kevin MD audience. Jodie, we'll start with you, and always we'll end with Kim. Jodie.
Okay. I think the take-home message is, help us out there. We're going to get to the point where it's been since the 80s. I don't think it's going to take us, though, 40, 50, 60 years to end it. I think now there's a galvanizing force. There is enough attention. There are strikes. There are, equity shutting down, equity investors and owners shutting things down. And I think once the people who make these decisions that harm clinicians and all others, they themselves need care, and it may not be there for them, right? Sometimes, until it happens to you kind of thing. But we're galvanizing for political will and public attention to shift policy and really bring a chorus of voices now to create change. And I think we're all gaining ground together, and it will take, a big alliance of those of us to work on it. And the last thing, I just want to add this. So a lot of where I come from too, and I think why I'm more of like hands-on action person, is there's a wonderful quote from Hillel: "If not me, who? If not now, when?" So that's how I approach things.
And Kim, we'll end with you. Your take-home messages.
Well, I love that, Jodie. And to kind of dovetail on that, the first thing I say is I end each episode of my podcast is to move the needle in healthcare. We all need to raise our voices, and we all need to care about each other. So to systems and leaders, take responsibility for the well-being of your teams. To boards, hold your systems and leaders accountable. And to individuals, and that includes leaders, make yourself aware of resources now, so if there's a time you find yourself struggling, you'll already know where you can turn. So resources such as the Clinician Burnout Foundation and the Dr. Lorna Breen Heroes Foundation are very good places to start. And Jodie has shared today about Clinician Burnout Foundation, so people can go to that website now and find out how they could access resources when they need them. And also on the Dr. Lorna Breen Heroes Foundation website, you can click on the tab that says Take Action, and then the highlighted line that says for healthcare workforce or for physicians. So then, when you're struggling, you would know where you can go. You'd already know, okay, these are the resources that I can access. And of course, you can always reach out to me and follow Stand Up for Doctors. I'll help you out as well. And we end our article in part by saying, no single entity can solve it all. By working together, we can synergistically make headway by sharing expertise, augmenting resources, and more. Together, we can ignite a real, lasting, life-saving chain reaction of change. So let's do it.
Kim and Jodie, thank you so much for sharing your perspective and insight. Thanks again for coming on the show.
Thank you.
Kevin.